When we sent you our annual report in the summer of 2021, little did we realise that a year later we'd be sending the same message to our stakeholders once again, that we continue to focus our energies on ensuring access to support despite the ongoing global pandemic. The staff team continue to support clients through virtual services, and we remain fully in service in 2021. Something shifted, however. We became increasingly aware of the ever-increasing incidence of dementia in Nova Scotia. The statistics are expected to double over the next 10 years or so, and we recognise that supporting individuals is only part of the puzzle. We developed our new strategic intentions this year, and they signal increased supports for those on the dementia journey, along with a commitment to collaborate with our government, healthcare and sector partners to identify and escalate advocacy issues facing our population. You will hear more about this at the end of this report. In the meantime, here are some highlights from our year. Even with pandemic restrictions, we had a busy year with our staff, partners, clients and donors. We saw 4,111 contacts via our InfoLine service, and our annual provincial conference had 356 people attend live online. We held 68 online public education sessions, and we saw a 40% increase in referrals from FirstLink partners thanks to targeted outreach. We facilitated 97 support groups and even introduced a new young onset dementia specific caregiver support group. Our IG Wealth Management Walk for Alzheimer's raised nearly $140,000, and we had $30,000 raised in our new online monthly 50/50 raffle initiative. We are so proud to offer support at every stage of the dementia journey, and in the last year we launched a new programme in direct response to need, a caregiver support group specific to those living with young onset dementia. You can read about the direct impacts of this initiative in our report, where Anne-Cherie Reynolds talks about the benefits of this programme. Here you can read about our Artful Afternoon programme, which continues to be a valuable resource for clients. We partner with the Art Gallery of Nova Scotia to provide a gallery tour and a guided art session using carefully curated art kits, with the materials being available for use by clients after the programme ends. We have seen success with this programme both in person and virtual, and we're thrilled to provide a space for people living with dementia and their care partners to connect with each other. And in 2021 we partnered with Dr. John Archibald for a really unique event. Dr. Archibald is a keen cyclist whose father was diagnosed with dementia in 2014, and so he set out to raise funds and awareness by cycling the perimeter of Nova Scotia, a 2,400 kilometre journey, to raise almost $30,000 for Alzheimer's research, supporting our society, the Maritime Brain Tissue Bank and the Dalhousie Medical Research Foundation. He even managed to stop for a picture with his father on the last leg of his journey. Thank you, Dr. Archibald, for your incredible commitment to our cause. The IG Wealth Management Walk for Alzheimer's took place in May 2021, and even though we couldn't be together in person, our supporters rallied to raise money. With 220 walkers across 40 teams, we raised nearly $140,000 to support Nova Scotians living with dementia. Sincere thanks to our incredible walkers who didn't let the pandemic stop them from walking their way in May and raising this incredible amount of money. Thank you. As you will be hearing throughout this report, 2021 was another year complicated by the challenges of COVID-19. As we detailed in our last annual report, the AS&S staff team responded with passion and commitment to these challenges, and we were very successful in moving the majority of our programmes online. We're eager to resume in-person programmes as soon as we can. However, we do acknowledge that online services do work well for many people, and we are committed to ensure they remain as we reopen our doors. Our Shaping the Journey programme is a great example of how we adapted programming for online delivery and how we are evaluating feasibility of online delivery moving forward. Our next challenge is to find the balance between online and in-person service delivery and to consider a hybrid approach to our work so we can reach as many people living with dementia in Nova Scotia as possible. One of our proudest achievements over the last 12 months has been the major progress we have made with our diversity and inclusion work. Dementia does not discriminate, and we are committed to being here for all Nova Scotians on the dementia journey. This year, we have adopted the concept of IDEA to steward this work. We use concepts of inclusion, diversity, equity, and accessibility to create a sense of belonging for clients, staff, volunteers, and stakeholders, and we remain committed to ensuring cultural competence in all aspects of our work. In addition to direct services for those affected by dementia, we are also committed to supporting our partners in the healthcare and dementia sectors. We have streamlined and targeted our FirstLink referral processes, and last year we saw an incredible 40% increase in FirstLink referrals and a huge 62% increase in referrals from 811. More referrals to us mean more folks are connected to the support that they need. We also support the sector via our formalised You First for Healthcare training programme for frontline staff and targeted outreach to long-term care partners. And our annual provincial conference continues to have huge impact. In 2021, our interactive virtual conference saw almost 400 attendees from across Nova Scotia and beyond. Financial management continued to pose a challenge due to the pandemic, but AS&S remained exceptional stewards of fundraised dollars. This fiscal year saw revenues at just over $2.6 million, with 45% of that figure coming from fundraising and 55% from our government funding sources. In terms of expenses, we saw a total of just over $2.684 million in expenses for the year, with the majority of that expense being in delivery of direct programs and services and our contributions to the National Research Portfolio. As we look to our future, AS&S is thrilled to release details of our 2022 to 2027 strategic intentions. This is the result of extensive work that began in September 2021 and included 9 community consults in all health zones, consults with staff and diverse communities, an open public survey, and key stakeholder interviews. This work signals not only growth in direct support for those on the dementia journey, but also a commitment to systems-level advocacy and innovation. We intend to support our partners in long-term and continuing care in ensuring appropriate support and care transitions. We want to ensure care providers have the knowledge, skills and resilience they need. We plan to work collaboratively to ensure a timely diagnosis for every Nova Scotian that needs one. We will leverage our extensive networks to cultivate dementia-friendly communities. And we commit to ensuring that our services are available to all people in Nova Scotia on the dementia journey, regardless of where they live or how they identify. It's a huge commitment, but an essential one. And we know that with your support, we can make it happen. You can read the report in full on our website. Thank you for being part of our ongoing story as we look to light the future path for dementia support in Nova Scotia.